we're live, and our guest today is Dr. Tro Kalayjian. He's in America. He's a board-certified physician. He's lost 150 pounds to reclaim his health, and he did it by ignoring much of the conventional medical advice that he'd been told. So he defines his life goal as to get his patients healthy and prevent disease. He wants to get his patients off their medications. So welcome. Thanks so much.
Yeah, very happy to be here. As I said, kind of off the air, you put out a video that really, Ali, you put out a video out that really inspired me, that really hit home on how nutrition can affect mental health. And as you can imagine, as a physician, telling people that, hey, what you eat can actually affect how you feel and how you think, we're faced with a lot of scrutiny. In fact, many doctors call us quacks, call us, I'm board certified in internal medicine. I'm board certified in obesity medicine. I trained in the Yale system, and here I am. I have people telling me that I'm a quack, and that when you say to your patients and to people that the food you eat will have an impact on your whole body. And your video that I watched was so inspirational. You shared about your own kind of struggles with mental health and how diet just completely changed that for you. And it really inspired me. So I'm so happy to be here. Very happy to talk with both of you, John and Ali.
Thanks. It's appreciated. And I was really kind of a little nervous before I released the video. Do you ever get that feeling where you feel like you might be sharing too much and that people won't want you to share? But it couldn't have been I couldn't have been more wrong in that anxiety. It was such a nice reception, and I think probably because so many people identified with it, and I think people who already had changed their health around a lot by changing the way they ate and what they put in their mouth, like things with alcohol and maybe drug use as well, that they knew. And so they understood. It was just nice to see someone else articulate it. And then for other people I know who shared it, they got in touch with me and said maybe their friends told them that they had since changed how they ate, or maybe cut down on their alcohol intake, and that they'd noticed the same change. And that was great. I was completely delighted that other people had been able to benefit in the same way that I had, which is the whole reason that I set up the Paleo Canteen in the first place, was to kind of evangelize. And I'm not kind of ashamed to admit that I feel like it's a bit of a calling now, to let people know how much of a positive difference it can make. And I get the sense that you feel the same way, and for the same reasons, because you were able to turn your health around, and you've now steered your profession in a different direction because of that. So why don't you tell us the story?
Yeah. So, look, I came from an obese family. If you look at my family's genetics, my grandfather died in his 40s from diabetes. He was overweight. All my mother's side is basically obese. My three brothers and I were all obese. And when I mean obese, my older brother was over 450 pounds. I was 350 pounds. My younger brothers, was over 450 pounds. My mother was overweight, obese. Father was obese. And so I came from what you'd call bad genetics. And I always wanted to escape that. And that's what led me to medicine. Really, at the age of 15, I knew I wanted to go into medicine. And so I tried my best to escape what I thought was inevitable diabetes and obesity. And when I remember being 15, and I basically went on a vegan diet, and I ran as fast as I could for as long as I could. And I lost 50 pounds, and I said, I figured it out. And then I couldn't keep that going, and I felt miserable, and I felt terrible. And then I basically gained it all back right away. And not only did I gain it back, but then came, you know, college, then came medical school, then came residency, then came being an attending. And I gained 15 pounds a year for 15 years. And I found myself at 350 pounds. And it wasn't like I didn't have any smart doctors around me. I was in the Yale system. I had the top cardiologists and the top endocrinologists telling me to eat more and eat less and move more. Why aren't you eating less calories? Why aren't you moving, you know, exercising? Little do they know I love exercising. I've always loved exercising. That wasn't the problem. The problem really was that I was always hungry. I was always hungry, and the food I ate made me more hungry. Just a quick little anecdote. My wife used to get, you know, ice creams. This is 5 years ago. We don't really get ice cream too much anymore, but she used to buy ice cream bars for herself. She never had a weight issue in her whole life. And she would actually take these ice cream bars and she started hiding them because I wouldn't eat one. I'd eat one and then eat the whole box and without even realizing it. And then she started hiding them in the back of the freezer. Somehow I still found them. And then she went to the basement freezer and hid it there. And somehow I still found it, finished the box. Then she hid it in the back of the basement freezer, still found it, still ate it, still finished the box. And then she started hiding it in the garage freezer. And what do you think happened? Of course, I found it, ate one, and then finished the box. And the same thing with cereal, same thing with a number of other foods. So clearly there was some element of insatiable hunger, and there was some element of possibly food addiction. Okay. And, you know, it's not like I wanted to lose weight. You know, my whole profession, my whole calling, my life's purpose was to lose weight, but I couldn't moderate. You know, this moderation really didn't exist for me. Now, in fact, if you fast forward, moderation is not a problem at all for me. But at that point, I was always hungry. Okay, and I think that's what really the crux of it. And then, you know, my wife challenged me in a very nice way. She's never had a weight issue herself. She's like, "You're a smart doctor. You scored on the 90th percentile on your board exam. You know, you're the chief resident. Like, why can't you figure out what's going on?" And so, you know, she really lit a fire under my butt. You know, she's like, "I got 3 kids." You know, she was actually pregnant with our 3rd kid. And she said, "Look, are you going to be around? You know, I don't want to lose you." And so that was a very potent motivator for me. Like, hey, just figure this out as if you were your own patient. And so that's when I went back to the medical school textbooks and the medical school notes, and I started reading books on nutrition. I read over 100, maybe 150 books by now on nutrition. I went to all the articles, the research articles on head-to-head studies. Okay, I'm an evidence-based doctor, or Yale, in the Yale system, you know, board certified. We want evidence. So I went to the evidence, and when we look for evidence for drugs, we want head-to-head studies. That's what we want. So I went to the head-to-head studies, and low carb did better than low fat. So I said, wait a second, maybe this is why the vegan thing didn't work, you know, 15 odd years ago when I tried to kind of lose weight and keep it off. So I started with low carb, and then the weight just came off. The weight just came off, and I was never hungry. So it became easier and easier. And then I read more into kind of low carb athletics. I read more into kind of low carb for migraines and low carb for mental health and ketogenic diets. And you know, there was a great Twitter community that kind of supported self-experiment, you know, with Sean Baker and Ted Naiman and kind of David Ludwig and all these people who are, you know, obviously Nina Teicholz and Gary Taubes, who all kind of, you know, their insights and their inputs made me say, wait, maybe I can go even lower. So, and the lower and lower I went, the better and better I felt. But hold on. hold on, I'm losing weight now. And now, I'm like, wait a second, all this steak and all this eggs I'm eating, it's got to be bad for my health. All the literature says it's bad for my health. And so I'm like, wait a second, let me check my cholesterol. And it's better. My LDL goes from 170, the bad cholesterol, to 70. My good cholesterol is from 20 up to 70. I feel better. My cholesterol is better. My blood glucose is better. I'm losing weight effortlessly. I'm never hungry. What's going on here? This is not what the Yale docs told me. This wasn't what I was told. This isn't multiple small meals that are the size of my hand. This isn't, 5 to 7 small meals a day. This isn't, everything in moderation. This is not what they said I was supposed to do. This isn't, eat fiber until you puke, This wasn't that. So what's going on here?
And for people who kind of maybe are coming to the podcast from more of a sort of general food perspective, like maybe they're because we're chefs and we're going to get some chefs on the podcast. Maybe you could explain kind of what maybe the sort of 5 or 10 main foods would be that you would eat when you were losing the weight and feeling full and feeling great.
Yeah. So of course I was told prior to this by all of my mentors and health experts to eat, heart healthy whole grains and whole grain bread and rice and in moderation, and banana, as many fruits and vegetables as I can eat, and to limit meat. I mean, this was the message, right? This is the message now. And a low carb diet is exactly not that. A paleo, low carb, keto, carnivore, paleo, carnivore, whatever. These are all kind of on the same spectrum. They're all lower in these things. They're lower in the grains and the rice, and they're higher in the vegetables, lower in the fruit, higher in the vegetables, higher in the low carb fruit. So like peppers, zucchini, olives, avocado, these are the kind of fruits you want to stick to, the berries, the strawberries, the blackberries, the raspberries, right? These are the fruits that you want to stick to. And the vegetables, anything green and leafy, basically. And then meat, eggs, fish, chicken, seafood, Greek yogurt. I mean, that's pretty much was my diet then, and it's my diet now.
How long has that been?
Yeah, it's been it's going to be my 5th year soon. So, here I am as a doctor, evidence-based, was given this input from all these, kind of experts in their field, and I'm doing exactly what they told me not to do, and I'm having enormous success. And not only am I having enormous success, the exact opposite of what they said. They said that my arteries are clogged. Well, I ultrasounded my own carotid, and there's my CIMT, which is a measurement of how much plaque or how much thickening is going on in your arteries. We can measure this, and I measure it in my office with an ultrasound. It's normal. 5 years after eating all those, artery clogging foods, and my cholesterol is better, which is how my arteries are supposed to be clogged. So how is it that I'm eating bacon, eggs, fish, chicken, seafood, and Greek yogurt, and a ton of, nuts and low carb fruit like we talked about, and my health is improving on every mark? And not only is my health improving on every mark, I told you I loved exercise. I went from being able to do 1 mile in 17 minutes to being able to do a mile in 5 minutes without any carbohydrates. So my mood and overall wellness improved. My cholesterol and every marker of heart health improved. My exercise performance and every marker of physical fitness has improved. My body fat went from 50% to 15%. And I'm eating until I'm full. And that problem that I had where I couldn't put that box of ice cream down, I can now look at a box and not even care.
And are you eating much less frequently as well?
Yeah. So I started eating 3 times a day just because I thought that was right. And now when you're not hungry, I often eat 1 time a day, or maybe, for like a 2-hour time frame a day. And that's completely fine for me. It's like, it's effortless. Whereas before, You couldn't hide the cereal from me. You couldn't hide the heart healthy whole grains. You couldn't hide the bananas and the ice cream bars and the Snickers bars and the rice and the pasta. You couldn't hide these things from me because I would find them and eat them, and I was never full.
I'm curious about how you go about eating, for instance, once a day, you said in maybe a 2-hour window. What kind of things would you eat in that time frame?
Yeah, so it wasn't always like that. And just I want to caution the listener that when people are switching the diet, I recommend not really restricting the time at first, because you may face intense cravings like what I'm describing with my relationship with ice cream at the time. But, you know, as time went on, if you're not hungry, why are you eating?
Yeah.
Right. And so are you eating out of habit, and are you eating out of stress, or, you know, so I reevaluated why I was eating, and I'm like, if I'm not hungry, why am I eating? Just because they say breakfast is healthy? I'm not doing that. And so I'm going to respond to what my body's telling me. I'm going to respond to my hunger. And when your hunger's down, man, you know, you generally just don't want to eat. So 1 or 2 meals a day is often what works for me.
Yeah.
Now, whereas before, you know, it was 7 small meals and it was never enough. And now my meals would look like, you know, yesterday I had, you know, maybe 1.5 pounds of ribeye and a small salad that my wife made of like arugula, cucumber, and tomato with some dressing. You know, she makes a homemade kind of vinegar and olive oil dressing. So that was my meal. You know, when I want to have a treat, if I ever want to have a treat now, my wife makes these amazing, she puts out, it's called Rosette's Baked Goods, and she's now a food manufacturer supporting me. She's made these low carb cookies made out of almond flour and sweetener, monk fruit. She's made these delicious, delicious cookies to support my kind of weight loss goals. And I told her about a year ago, why don't you know, support other people and put this out? So anywhere in the United States, you know, you can buy her cookie mix, or you get her cookie mix, and you can make a cookie anyway. You know, if I really had a sweet tooth, which is rare now, you know, or it's a birthday party or something like that, she'll make these great chocolate chip cookies or peanut butter cookies or no sugar cookies, you know, with almond flour and butter but mainly my diet. What's that?
What's her company called?
Rosette's Baked Goods. So if you go to rosettesbakedgoods.com, yeah, you can, not that, you know, it's, you know, it's obvious it's my wife and I support her, but, you know, I eat these very rarely on occasion now. So
yeah. This is something that comes up with me and my fledgling online food delivery business. Is I kind of wondered whether to include desserts or not, and I have included desserts along the way. Some people say it's a route into binging again, and some people say no, it's a really good bridge away from the sort of standard Western diet. And I could say I would say that it could be either. For me, it's actually really helpful if I'm stressed out and I feel the urge to reach for bad food. Then it's actually like a kind of like a stopgap, you know. It stops me from going the whole way. So if I eat, you know, some you know, a cake made from eggs, butter, sweetener, a little bit of almond flour, then it's not going to stall me too badly. It's not going to make me, it's still got nutrition in it, and it helps me to, you know, cope with the stresses of everyday life. So I can see there's a place for them, when the alternative might be to either deprive yourself and feel unhappy, or really start binging on stuff that's not healthy at all.
Yeah, in fact, people ask me all the time, what do you feel about diet soda? What do you feel about Rosette's cookies? Yeah. You know, and I tell them, I don't think that they're an ideal for body composition and health. I think that they're a response to us being human, us being social creatures, us being exposed to crap food everywhere. And I think that if it helps you, if that cookie prevents you from going to the Oreos, and I don't know what you guys call them by you, but, you know, the Chips Ahoy and the crap cookies, hey, that's a win.
Yeah.
If Diet Coke helps prevent you from drinking regular Coke, That's a win.
Yeah.
Okay. If Diet Coke makes you more hungry and it's just tagging along these cravings for you and not helping your health goals in any way, that's not really a win. You know, if you're just losing control on Diet Coke because it has no calories and you're just keeping that sweet taste addiction going, then it's not a win. So ultimately, I think it's where you are in your journey.
Yeah.
And for me in the beginning, these things were incredible. I would eat protein bars and keto cookies all the time. Okay. And they were crucial for me to get off the, you know, the candy bars and the ice cream.
Mm-hmm.
Right. I mean, you'd never see me having a protein bar now,
mm-hmm.
you know, or if it is, I'd make my own with egg and kind of high quality way. I'd make it at home.
Right.
So I think who you are changes with time.
Yeah.
Right. How did I get from that person addicted to ice cream bars to now, you know, my kids may eat ice cream once in a while and it's no issue for me even watching them eat. And, you know, it's not even a problem at all. So who you are will change over time, and how these things affect your health goals will change over time. The same thing with nuts and cheese. People ask me, are you against nuts and cheese? Because sometimes I come out strongly against nuts and cheese. I'm not. They're perfect foods for most people when you're just starting, right? It's excellent food, right? It's real food. It's nuts and cheese. But as you go on, if you want to improve your body composition and your glycemia, and, you know, it's also the way we use nuts and cheese. It's often a snack, you know, a relic of snack time, you know, a relic of snacking culture. So ideally, you know, as you progress along the diet, that snacking culture diminishes and the needs for these like snack foods diminishes. So it's not that I'm against, you know, high fatty foods like nuts and cheese, but most times when people come to me stalling on weight loss, if they eliminate these or limit them, they do much better.
Yeah.
And it's often a number of issues at play here. But so again, where are you in your journey? Maybe nuts and cheese are exactly what you need to do well. And adding butter to everything is exactly what you need. Well, as you progress, you know, are you just eating that butter because it makes your steak taste 10 times better? You know, what difference is it than the sugar and the barbecue sauce you were adding to it, or the ketchup you were adding to the French fries? Maybe you don't really need to eat that. Add the butter to the steak, right? Same thing with cheese, right? So in the beginning, it may be great and it may be serving your health goals, right? But, you know, if you add cheese and bacon to that plain grilled chicken breast, man, you're going to eat that second or third one quite a little bit easier than eating it plain. So, you know, a lot of this is nuance, and there's no hard and fast rule, just like you're saying with the sweeteners in your case. Right? There's no hard and fast rule. People have been eating monk fruit for 3,000 years, right? So, you know, it's not that is monk fruit good or bad? Well, you know, yes and no. Yes, it's bad, and no, it's not bad.
Mm-hmm.
So I 100% agree with your nuanced opinion. You know, where are you in your journey? It's very important that you ask yourself, is this food triggering me to eat more? And if it is, maybe it's not aligned with your health goals. Well, if it's triggering you to eat more and it prevents you from eating crap, maybe it is aligned with your health goals. So it's important to know yourself, I think. And it sounds like you're preaching that message.
Yeah, for sure. And it sounds, from what I've read about your new practice, that and how you approach talking to patients, that you're very much of a mind to give people as much information as you have about it, and from what you've seen clinically and from what you've read in the literature, and then let them make a decision about which direction they go in terms of, you know, exactly what they're eating.
Yeah, look, I'm a consultant, you know, I'm not a nanny. Like you know, I can't give you your answers. Ultimately, what is triggering you? You come and tell me, like, this is your homework assignment, and I give it, you know, what are the foods that make you more hungry? You know, what are the foods that leave you feeling full, feeling great, feeling like you can go hours without eating? So let's figure out what's doing it for you. So for some people, they tell me if I put butter on my steak that I can go a whole day without eating. Well, that's a win. Some people tell me if I put butter on my steak, I can eat 3 more steak and I'm hungry again, you know, for more. Well, maybe it's not a win. So, and this is in the low carb paradigm. So this is once, you know, for everybody listening, this is once you've eliminated the sugars and the processed carbs and the, we're talking about the nuances of adding a fat or limiting the fat, right?
Mhm.
So, but you can apply this to anything, the same with Diet Coke, which has no, carbs in it, or it's just the flavor, salt, and caffeine, right? Is it supporting your health goals? Just ask yourself that question.
Yeah.
Is this thing supporting my health goals? And it's a really, you'll be able to tell me the answer. I won't need to tell you the answer. You're going to tell me. I had a Diet Coke. I was immediately more hungry. Well, then, do you want to be buying more Diet Coke, or you want to feel less hungry? What's your health goal? So patients give me the answers.
Yeah.
I just interpret them. I interpret it and feed it back to them in a way that's palatable.
I read somewhere that you described hunger as the missing link in nutrition. And it sounds like you've really transformed the nature of your hunger. So why do you think it's an unanalyzed concept in nutritional circles?
Yeah, it is a fairly unanalyzed. It's fairly unanalyzed, and it's hard to analyze.
Yeah,
it's hard to analyze. I think because take me at 350 pounds, addicted to sugar. If you gave me a protein bar and a protein shake, I would have done phenomenally well in the beginning eating that way. Okay, the protein and volume would fill me up. I'd be eating a food that was just as palatable as, or close to as palatable as, the food I was addicted to, right? But take me now, lean, very insulin sensitive, and, who has no problems with kind of food addiction or cravings. And that protein shake or protein bar is just unnecessarily palatable. It'll make me more hungry. It'll make me eat more than I normally would. So how can you measure the effect of this food in two separate populations, right? One that it has intense cravings and maybe food addiction, and then another one that's insulin sensitive and maybe doesn't have the same physiology, the same hormonal systems driving their hunger. So I think the people who would be interested in finding these things out are the food manufacturers.
Yeah.
But it's hard for them to develop this because, even if you take your cookie cutter obese person, there's a lot of different things that lead to obesity. It's not always food cravings. Sometimes it's stress eating. Sometimes it's social environment. Sometimes it's depression.
Sure.
And so there's a lot of factors that come into play. And I think that paying attention to hunger is critical, but it's not the only factor. And it's hard for food companies who would be supporting this research to design the studies to figure it out.
Yeah.
I don't know if it's the answer you're looking for.
Yeah, no,
I mean, well, let's even talk about it in a different way. I can tell you, without a doubt in my clinical experience, if somebody has high insulin levels, right, they're hyperinsulinemic, right, or they're pre-diabetic and hyperinsulinemic, meaning they're have high blood sugars, they have high insulin levels, and they're a pre-diabetic range of health, that their hunger is going to be out of control.
Yeah.
But when you look at the population, right, you look at insulin level over a population and diabetes over a population, well, the insulin may be high and you may be a bad diabetic, but it may be early on in the disease. Well, later on in the disease, when your pancreas starts giving up, the pancreas is the organ that makes the insulin. When it starts giving up, the insulin levels drop down, but your hunger may be equally out of control, right? So when you try to look at hunger related to insulin, it's not really clear. You can have those diabetics who have very high insulins, like, the 15-year-old who's been eating the Hershey's bar his whole life, right? His insulin's through the roof and he's pre-diabetic range and his appetite's out of control. Okay, now you have a 50-year-old who's had a lifetime of diabetes and their pancreas is shutting down and, has been overexerted for a lifetime. Well, their insulin level is not high. So now when you look at this hormone insulin over a population, you're trying to figure out what's the answer. It's hard to figure out that answer because there's two ends to this equation, and it's not it's a dynamic system. So it's not easy to develop the science to come up with these answers.
Yeah.
I mean, ultimately, you just got, I mean, how do you feel when you have Allie and John's, you know, meals? Is it filling you up? Damn right it's filling me up. Well, then you're eating something good. You know, is it leaving you more hungry? I doubt it. If you, you know, knowing you guys, you're putting very wholesome foods in there. But if it's leaving you more hungry, well, let's reevaluate what's going on. I think it needs to be approached clinically, if that makes sense, not scientifically.
Yeah. Something on that point that we were talking to, we had Tucker Goodrich on, and I was saying to him my little pet theory about my experience with doctors, which is that for nutrition, overweight, mental health issues, it can be quite often the case that doctors are skeptical of the benefits of changing how you eat. And my theory was that it's because they themselves typically haven't gone through that. You know, my doctor, when I was having trouble with mental health and my weight, I think has always been thin and balanced in, you know, mentally and happy. And so just almost couldn't believe that, you know, or maybe thought it was a failing in me that I couldn't control myself, or that it was a character flaw that I was, you know, depressed. But my pet theory was that it's typically that doctors haven't gone through it themselves. And Tucker pointed out that actually, you know, you were skeptical before you changed how you ate. And so what do you think, having been a doctor in that position, what do you think motivates doctors to be overly skeptical to the point of dismissiveness at that time?
Look, when I was 350 pounds and I had a diabetic come to see me, I would write a prescription to the nutritionist and say, go to the nutritionist. You're probably going to need me in a month later to start taking your medications. That was the way I approached it.
Right.
If you come to me now, the message isn't different.
Mm-hmm.
The message is food is the poison that is causing the problem. Okay? What you put into your mouth, what you do every day, the people you surround yourself, the amount of sun you get, the amount you move, this is, you know, what you put on your body, what you smear on your body, on your face, and, you know, under your armpits, and what soap you, all these things are affecting your life day in and day out. Okay? The food you eat affects your total health. That's the message now. Well, how did I go from being the world's, you know, thinking basically diet was a form of alternative medicine to this? Absolutely. Experiencing it.
Yeah.
Okay. What I help doctors do now is understand it in clinical ways, in clinical terms. And I ask them, you married? You know, do you have a wife? Yeah, I have a wife. Okay. That time of the month, is she more hungry or is she not more hungry? And I ask my women patients who believe that they have a character flaw when they're overeating, you know, are you more hungry? Yeah, they're always more hungry. Yeah, more hungry. Yeah. Okay. Do you control that? No, it just comes. So the hormones come and you have no control over the effect. And then I'll ask the doctors another question. Have you ever dosed insulin? And they'll always, of course, say yes. Well, what happens if you give a little too much insulin to a patient? Oh, they get, their blood sugar goes low. Well, what are the symptoms they have? Well, they start getting a little shaky, you know, maybe they want to drink something and they're ravenous, like they can't control it. It's like, okay, so when you talk to your patients who have type 1 and they're dosing insulin, or type 2 and they're dosing insulin, and they just get a little too much, you're telling me that they get more hungry. Yeah. Do they have control over it? No. Well, so there's a hormonal drive that's causing them to eat. Okay. There's a hormonal glycemic state that's driving them to eat, and they don't have control over it. Oh yeah. Well, that kind of makes sense. You know, oh, wait a second. I get what you're saying. So the first step is getting them to understand that our drives to eat, right? If you are Paleolithic, you know, paleo canteen, right? If you were a Paleolithic man, okay, and a grizzly bear or Paleolithic woman, grizzly bear is chasing you through the forest. You escape. You're stressed out, okay? You're in an environment of food scarcity and you see a gazelle. You want to be insulin insensitive, and you want to store that, you want to eat that gazelle because you're hungry at that moment, because the stress is driving you to eat, and you want to store that as fat because you're insulin resistant. So insulin resistance and fat storage was actually a survival advantage. It's a superpower, okay? It's a superpower, all right? So 10,000 years ago, your kids, because you had diabetes when you were pregnant or pre-diabetes when you were pregnant, survived because they had a stable blood sugar in utero. So diabetes is a survival advantage. And somehow we've convinced people that it's a weakness. It's not a weakness. Your body is designed to do what it's doing. Okay, it's designed, it's acting as intended. Give it the right inputs and it'll act as it's intended. You give it the donuts, your insulin's gonna go through the roof, you're gonna store it as fat, and you're gonna be more hungry. You give it the gazelle, okay, you're gonna be full, okay? You're not gonna store it as fat. You're gonna feel, to a greater extent, relatively, right? And you're gonna be full, and you're gonna be a beast. You're gonna be awesome. Your health is gonna improve, okay? You're gonna eat those fresh seasonal fruits and vegetables, right? Low carb fruit and vegetables, right? You're gonna do well. Not the engineered bananas that we eat now that are 3 times the sugar than the bananas from 10,000 years ago, right? Not the same ones, right? So low carb fruit and vegetables, yeah, you eat the seasonal ones, you're gonna do better, okay? You're gonna do as your body was intended. So what I try to do is I try to make it make sense to my colleagues. This is not a weakness. This is a hormonal and glycemic drive to eat. Just like your wife, or yourself, or your patients at that time of the month when there's this hormonal drive, their attitudes change maybe, and they get more hungry. Ask any one of my female patients walking in my door, I ask them this question, they say, yeah, I'm hungrier. Yeah. Can you control it? No. Is it weakness? No, it's normal. Okay. You ask the diabetics taking insulin, what happens when you dose insulin and it's a little too much and your blood sugar goes down, or goes down too quickly? Yeah, I'm more hungry. Is it under control? No. It's not a character flaw. It's a superpower. It becomes a character flaw when you're in an environment of donuts and eat donuts in moderation, and whole grains and eat whole grains in moderation, and keep eating, small meals all throughout the day. So I try to make it make sense for my colleagues so they understand. But they're trained to be skeptical. We want them to be skeptical so that when you're taking some bogus supplement, they're telling you, this isn't tested. What are you doing to yourself? You could get liver failure. It's unregulated, right? You want them to think critically, but it's gone overboard where they just view diet, the link between diet and total health, as alternative medicine, and it's not. The data is there. The problem is this. It took me 1,000 papers to read on nutrition. It's taken me 100 books and my training, and it's still not clear cut. You have to take these pieces and put them together. There's no one answer.
Yep.
So I say it's mosaic theory.
Like you to do that.
What's that?
And it seems to take individuals like you to go on the sort of unorthodox path and make these meta-analyses. Yeah,
it's mosaic theory. There's a theory in kind of financial worlds of like, how do you know a conclusion about a company or something like that? How do you predict? And there's a mosaic theory is basically like, you can pick apart these pieces, right? And then you got to put it into the whole to make the mosaic. With regards to nutrition, it's mosaic theory. Okay. We don't have these answers with regards to medicine and nutrition. And so the guidelines are like terrible. They're wrong, but they can drive some of the mosaic. And all these studies that we've read, and they're in the literature. I'm convinced at this point, it's in the literature. The answer is there.
Right.
Right. But it's got to be aggregated in that right way. So the problem is we have to educate, my colleagues, and in the way that I had to get educated, starting with these common sense approaches to get them over these biases that they have, but then giving them these tools, showing them the diabetics who have depression do worse, independent of what they eat. The diabetics who have B12 deficiency do worse, independent of what they eat, right? So that we know nutritional deficiencies cause mental disease. We know nutritional deficiencies cause behavioral issues in ADHD and these additives that cause behavioral issues. So now how do you put these puzzles, these pieces of the puzzle together to combine nutritional deficiency effect on mental health, to combine how diabetics do when they have concomitant nutritional deficiencies and mental health issues, to combine, the outcomes of obese people with, obese patients with nutritional deficiencies and mental health. And how do you put this whole puzzle together, right? It's not clear. I can't spoon feed the answer.
Yeah.
And it's disparate information that comes together to make this whole puzzle piece. That's why doctors are lost.
Yeah.
That's why
I guess
doctors are lost.
what's super valuable coming from people like yourself at the moment is your clinical experience, because you're seeing cases from your patients where they get better or worse, and you can track why that's happening. And I suppose for anyone listening who might sort of be on the fence about it, or who's tried it and it hasn't worked, what would you say is like the big the things that maybe don't work about it, or that send people off track, or the reasons that people stop kind of trying to live in the way that you suggest?
Look, my advice to most people coming to me, or like kind of is start with this, eat meat, fish, chicken, eggs, seafood until you're so full you can't even imagine eating something else. Okay, then add as much low carb fruit or vegetables you need to make your grandmother happy. And then that's the starting point, and do that for 2 to 3 months. What's the big deal? What do you have to lose? 2 to 3 months of eating fruits, low carb fruit, vegetables, and a whole bunch of, real food. Okay. You start there, you do it for 3 months. The people that have failed usually haven't been given enough advice, haven't been guided appropriately. Hydrate yourself, add salt. You remember when you kind of do this, all that processed food has salt that your body now isn't getting. So add salt to your diet, because all that processed food you ate that you're now not eating had salt in it. So give yourself salt, drink water till your pee is clear. That's my kind of general, like if I had to give 3 sentences of how to start. The people who fail usually fail because the symptoms suck. Okay. Coming off of sugar and processed carbs sucks. Okay. People fail because Pop-Tarts are awesome. Okay. Because the ice cream bars I were eating are great. And because and another reason why people fail is, I'm going to do this to lose weight. And then they eat these little, I had 1.5 eggs, I eat half a chicken breast. Like that's not reasonable. Yeah. If you're not eating rice and pasta and Pop-Tarts and Snickers and, M&Ms, if you're not eating these things, well, better make sure to get more vegetables, more low carb fruit, more meat, more fish, more chicken, more eggs, right? And more Greek yogurt, because you just took out a whole bunch of stuff. Later on, you could worry about eating less. First, just make this work. So for people who've, done Atkins and failed, for example, it's usually an underlying food addiction is strong, and they're not really fessing up to it themselves, and how difficult it is. And number 2, they're under eating. You have to kind of give yourself whatever it needs in the beginning. And maybe then the cookies that you put into your, meals is exactly what they need. So make it what you need to get yourself glycemically stable, insulin and hormonal state stable, then worry about eating less. So does that answer the question? I don't know.
Yeah. Yep.
Do you find it frustrating that the medical establishment is so entrenched in this, what sounds like bad nutritional advice and calling you a quack and whatnot? Or do you just feel stimulated by that to carry on with your own clinical practice?
Look, I have to be honest with you. You know, in the beginning, it was quack this and quack that. But then when they're type 1, when you send them back a type 1 patient who was previously on 100 units of insulin and now on 30 units of insulin, and their A1C is better, you know, then they call me back saying, what did you do? you know, so, and they call you a quack, and then all of a sudden their patient's liver disease is gone, and you send them back without liver disease, without 2 diabetes medications, and their blood pressure is resolved in 3 months, you know, off of 2 medications. And then they're like, wait a second, what's going on here?
Yeah.
So they call you a quack until they see it. And then they're like, wait a second, help me do this. You know, what are you doing? I want to know. And so now I have, you know, for the next 4 months, I have somebody shadowing me, a provider in here basically every week.
Really?
Different physician, different nutritionist, see what we're doing here. I mean, it's not just the low carb stuff. We do a lot of things with remote tracking of data. You know, it's not like, here's your blood pressure medication, go home and come back, see me in a month, right? No, here's your blood pressure cuff. Take your blood pressure twice a day. We're going to track you remotely. Here's a continuous glucose monitor. We're going to track how you're, you know, how the food's affecting you, and we're going to track it in real time.
Mm-hmm.
So, so they take the measurements at home, the blood pressure, we see it in our office every day, okay, in real time. They're eating their food, we see their 24-hour glucose readings. You know, they're getting on the scale in the morning, we see the body fat, the body water, this muscle mass. So what we're doing here is we're tracking people in their homes completely remotely so that we can help them get their goals. And when most of the time, you know, the weight goes straight like this, and the blood sugar goes straight down, and the blood pressure goes straight down. Some of the times, you know, after a couple months, they start going back up. So, you know, all right, they're done with the program, but now we reinitiate contact. Hey, Mrs. Smith. Hey, Mr. Smith. You know, we saw that the blood sugar's, you know, going in a direction that's not good. Can we get you back in? Can we talk with you? What's going on? Are you under stress? Are you feeling okay? Are you depressed? You know, are you having, you know, some problems with cravings? So it's a different way of doing this. We treat it as a lifelong thing, and we want to make it easy for you. We don't have you come in. We could just video with you. We have, you know, telemedicine software. So we make it easy for people. Fine, you're out at your job. Well, we could talk to you for 5 or 10 minutes, you know, through a video chat, or we could just text you. You could text our office. So we are trying to change the way we do this, where a patient, like, you want to make it easy for somebody and you want to give them food in their home so the decision is easy. We're monitoring them to make sure they make the right decisions and make the help easy, yeah. Right? To make the maintenance of health easy, right? So that's what we're trying to do here. And I you know, so far we've had really good success.
Yeah. Does that involve sometimes providing meal plans?
Yeah, well, we try to just educate. We have like a baseline of education we provide, yeah. And then we give kind of guidance, right? Because the meal plan changes, right? So the meal plan changes for the person in the first 2 months and the person in the last 2 months, right? You know, as appetite changes, you know, if you come in day one and I say, well, I want you to eat 1 meal a day, you know, that's, you know, insane. For somebody that's eating ice cream 3 times a day, like I was, you know, obviously I'm exaggerating, but you get the point.
Yeah.
You know, so we kind of start them on a plan and see how their progress goes and make small changes over time. You know, we have weekly contact with our patients, so it's not a traditional practice. Mm-hmm. You know, how you feeling? How's your appetite? Are you able to skip meals and it's easy for you? Yeah, okay, well, let's try intermittent fasting now. So, you know, we work in a number of ways, and we meet people where they are. They want to just eat meat, fine. They want to have vegetables and low-carb fruit, fine. They want to do paleo, and they want to have some sweet potato, great. We'll work with that. So we work with what people want to give us, well, how's that sweet potato reacting with your body? Let's see what it does on the CGM. Are you able to tolerate it? Are you not able to tolerate it? Maybe you're not able to tolerate now, but that doesn't mean later on when fasting's easier that you can't have a little bit of sweet potato, So we reevaluate kind of the diet and what patients are craving, what they want, and we try to make it work for them over the long term.
I think that's brilliant, the technological approach.
Yeah.
Like the Virta Health Initiative, and it's a company as well, but they're all about monitoring, tracking over the longer term to help the patient understand themselves what's going on. I think that's powerful. Instead of just receiving the 10 commandments from your doctor, you're actually looking at the data and able to see it in a simple graph. This is what happens when I do X, Y, or Z. And to be able to get that sort of data from an individual over the long term, that's got to be a big part of the future for everyone understanding their own health.
I think a little bit of it is accountability. It's not like you're getting on the scale, in the privacy of your own bathroom, or avoiding the scale in the privacy of your own bathroom. You avoid the scale, you get a text from us, hey, we're not getting your measurements. And so it's a little bit of a big brother, but it's not like, hey, it's not like, hey, we're trying to shame you into it. It's like, hey, we're here to help you. This is a safe place. We want you to discuss your weakness so we can fix the problem. And we make it a safe place. Like, if it was hard for you, the ice cream is hard for you, we'll get you a low carb ice cream. Okay? If the cookies are hard for you, we'll get you a low carb cookie. Okay? So we want our patients to be open and safe, discuss their weaknesses, and we want to track those weaknesses openly. We want to track their CGMs, so when it spikes, they're okay with us reaching out to them. What happened? Oh, it was my anniversary. I ate a piece of cake. Okay, best strategy now is fast, for breakfast, fast for lunch, clear out that glycogen so you're back to metabolizing fat. So we try to make it a safe place to share your weakness, because the weakness is how you grow. And so it's not about hiding that weakness and hiding the shame and putting the shame deep down inside and letting it boil out as depression and anxiety later on. No, bring it out. Let's talk about it. That's how you're going to grow, and so, look, we're trying to reach patients technologically, on an emotional level, empathetically, nutrition, mental health, overall health. We're really trying to do something, but it's little old me. Virta's got 100 people with them and, tons of money, but, it's little old me over here.
So do you see their emotional relationship with food changing through the course of treatment with you?
Yeah, I have a case series, hopefully it'll be published soon, on binge eating. I had somebody who was binge eating pizza until it hurt multiple times a week, who now has no care for pizza. I had somebody that, was basically binge eating Kit Kats and chocolate, going out in the middle of the night, having to run to the convenience store, get some chocolate, who now maybe that happens once a year versus twice a week or 3 times a week, and in those patients, first it was the low carb pizza, and first it was the protein bars, the chocolate protein bars, and then they're just off of it. They don't really use it, or they do some unsweetened, they put monk fruit and cacao, 100% cacao together and make a, so they melt 100% cacao down, they'll put a sweetener in it, and now they have, if they really want chocolate like the way they used to, they'll have unsweetened cacao, and it supports their health goals and it nourishes them, instead of, being that milk chocolate, that sugar plus fat combo that drives the brain crazy and makes them want more. So yeah, the relationship with food changed, the mental health changes, and sometimes it's slow and sometimes it's like right away. 6 weeks come, they're in ketosis, they're like, I'm not hungry. How I binge ate pizza, I don't want it anymore. So it's awesome. This is what we do. We love seeing that.
Could you tell us a bit more about any of the more mental health aspects that you see?
Yeah, it's funny, you know, that like anxiety is down in a lot of my patients, mental clarity goes up in a lot of my patients.
Right.
You know, very easy to eventually come off, especially after like 6 months. It's easy to come off of the antidepressants.
Mm-hmm.
You know, I find that, you know, sometimes they want to, and I don't initiate it with the antidepressants, because then you're fighting the psychiatrist and all this.
Right.
But if a patient says, I'm really feeling great, I think I'm ready, I'll taper it for them. So I don't push the coming off the antidepressants. Whereas like with diabetes medications, if they're going to do the diet with me day one, we're usually stopping it.
Yeah.
Okay. Because we're monitoring it very closely. But with the mental health, you know, like I said, it's, you know, obesity, just like mental health, it's not always nutrition. Nutrition helps, right? I mean, if your, you know, father died and your spouse died, or, you know, your wife cheated on you and you lost a kid to health, or, you know, like, you know, you were sexually assaulted at a young age, like these things don't go away.
Yeah.
Yeah.
Right? They don't go away. They don't disappear. No diet is going to make that disappear.
Mm-hmm.
Right? But can it help? Probably can help. Probably is going to help, right? If the sleep's better, the hormones are better, the nutrition is replete, I don't think it can hurt.
Mm-hmm.
I don't think it can hurt. So with regards to mental health, it's usually patient driven. I'll bring it up that my patients often come off of antidepressants. I'll say, when you're ready, talk to me about it. And I mean, look, we know our patients better than any other doctor does. They're texting us. Our whole team knows them. You know, myself, my office manager, my medical assistant, right? We're communicating with them day in and day out. We see them very frequently, and we're like family. So, you know, we're family without the baggage, you know, without the, and so I think we're in a great position to help them. Deprescribing is huge, man. We do it all the time. We do it all the time.
Talking about family and going back to kind of the food environment when you were growing up, did you, what kind of stuff did you eat when you were a child? And was it like traditional stuff? And who did the cooking?
Yeah, both of my parents were accountants, and they came here with nothing.
Where from?
Yeah, my parents are both Armenian. They actually were born in Syria, but they're Armenian Syrians, and they immigrated here in the 70s. There's a lot of war and turmoil there at the time. And so the ethnic food is a cross between traditional Armenian food, kind of Turkish food, and Syrian food, because of my family history and how they migrated and got to where they are. But when they came to this country, they basically had nothing and had to work like 2 full-time jobs. So here I am with periodic ethnic food, but then pretty much during the week, it's the cereal and the, you know, the convenience food that the 80s was notorious for. You know, the cereals and the whole grain bars and the Pop-Tarts and the, you know, fast food. And, you know, so on the weekends, my mom would cook up a nice homemade meal, but then during the week, it was like, you know, we're going to heat up the hamburger or whatever was in the freezer. Mm-hmm. And fast food was a big part of that. Pizza was a big part of that, you know. So it was a, you know, obesogenic environment of mm-hmm. processed food. So, you know, I don't blame my parents. They would do anything for me. In fact, we were all obese and we were all bewildered, you know, like we were all, and now over the past 5 years, you know, I lost 150 pounds. My older brothers lost almost 200 pounds. My younger brothers lost 50 pounds off 2 diabetes medications. My mother's lost, you know, 50 pounds off of 2 diabetes medications. Father's lost 75 pounds off of 2 blood pressure medications. So, you know, we just went from like genetics being the cause of obesity to no, it's shit food, you know, mm-hmm. being the cause of obesity. And now everybody's, you know, cooking meat, fish, chicken, you know, low carb fruit and vegetables. And that's the diet. And, you know, and so it's, you know, it's a stark contrast. You know, the ethnic food was amazing and we still eat that, you know.
Yeah.
Every now and then people say, oh, you don't eat grains. Like once a month I'll have tabbouleh with like a little bit of cracked bulgur in it. Like, I'm not eating whole grain Pop-Tarts. Yeah, once a month I'll have a little bit of tabbouleh, but for the most part I don't have much grains either.
Yeah, the food from that area it's one of the few cuisines that someone who's eating paleo can eat almost everything without worrying. All the grilled meat, the shish kebabs, and all the delicious pastes and salads, everything apart from the pita bread, pretty much.
Yeah, the pita bread's gone, and the pita bread, trust me, I don't miss it. But all the stews, like, people come to me and they want to like grill everything. I'm like, don't forget the slow cooker, don't forget the stews, don't forget the chili. Like, put the bones in there, get every nutrient you can out of that, because your great grandmother did. You better believe it. They used, that bone marrow was priceless. It was priceless, in terms of nutrition. So I try to remind my patients, grill the food, fine, make it easy, but don't forget, put that, meat in the slow cooker, let it, slow cook, make it chili, like, get something, stew some food. And it just, with a low temperature, longer cooking, and really begin to enjoy food different. Let me tell you now, if I have like bone broth, I feel like Superman. I don't know what it is. If I have like, a nice slow cooked chili or something like that, I feel like, made with bone broth stock. Yeah. I feel like a superpower. It's insane. And you feel that nutrition now, whereas I never felt that way. And if somebody told me that, I'd be like, you're crazy. It's just a placebo effect, but I don't know. I like bone broth is like a super, man, let me tell you, it's like, that special serum Captain America had or something. I don't know,
I feel the same way, and it's particularly, I think, I really like bone broth made from beef bones and lamb bones, but for some reason chicken stock, I just love chicken stock. I don't know if it's because I would eat more chicken soup when I was a child, so I've got like emotional attachment to it or something, but it really tastes like just pure health.
Yeah, it's the best stuff.
Yeah, and eating it nice and warm with salt, and you kind of like get the flavor. Yeah, chicken stock you got to be careful with. Sometimes they got the carbs in there if you're buying it. If you're making it, great.
There's also the question mark about the fat as well. Some people think that schmaltz has kind of maybe got residue from the chickens eating so many grains. There's the sort of linoleic acid coming through, whereas you talk to other people like Amber O'Hearn, and she'll say, well, if you're eating low carb, then probably you're not storing up problems for yourself with linoleic acid so much. So people even in the low carb community fall on different sides of the fence on that.
Well, let me tell you, when I eat chicken and I eat pork, I just, like, I've gotten nauseous from pork.
Yeah.
I don't know why. I love ribs. But like if I eat too many ribs, I get like this sick kind of feeling. So I don't know if that's I don't know if that's the omega-6 fats, but I think honestly, if you're eliminate, I don't think most people have to care at all. If you're eliminating all the crap processed foods and you're getting, fish in your diet once or twice a week, I don't think you even need to think about anything else. Have the chicken, have the pork, have the beef, the lamb, whatever you want, and don't even think twice about it.
Yeah.
So, I think just, I try to tell people, just get fish and seafood once or twice a week, and you're fine. Don't even think about this omega-6. And as long as you eliminate the crap,
yeah,
and you're using, like, if you are going to use oils, which I generally don't add much oils in my cooking or add fat. I don't add fat, but if I do use an oil, it'll be avocado oil or olive oil. And it won't be like the olive oil is like a whole separate topic, because half the industry is cut with canola oil and crap oils because, they want to make more money cutting it with cheap oils. So make sure it's just a high quality olive oil or avocado oil. That's pretty much what I use for cooking. Most of the time, I don't think anybody's got to worry about that topic. I agree with Amber. You know what, Amber, if you're listening, we agree on a topic, you can unblock me from Twitter. Okay. So if you hear me, we agree. So, I don't think you have to worry.
I hope I can take credit for bridging between two people there. That's nice. That's a nice moment. Yeah, I tend to agree that it's kind of the Pareto thing, it's the engineering thing, that if you can deal with 80% of the issue, usually by looking for the 20% of the causes that result in that 80% of the issue, and then you don't really you can start to make a finer adjustment after that, but probably who cares? You'll be healthier than you've ever been, you'll be happier than you've ever been, and just by taking care of the big things.
100%. That's why people ask me about Diet Coke, and I tell them it's not an ideal, but maybe don't address it at first. Maybe don't address it at first. People ask me about the keto cookies that sometimes you may be putting into your meals. Not a big deal in the beginning. You don't need to address that at first. We'll address it later on. Let's do the big things. Let's make this lifestyle happen, and then, let's deal with the big chunk before we deal with the small chunks. People ask me about grass-fed, organic, and I say, yeah, it's an ideal. Pasture, yes, absolutely, but not really mission critical in the beginning. We can address it later on. When your appetite is much down, it's significantly decreased and really down, then eating, grass-fed beef's not so much of a big deal. Whereas in the beginning, when you were eating 2 pounds and now you're eating 1 pound or 1.25 pounds and that fills you up, well, it's much easier to think about grass-fed versus not grass-fed, right? So I punt on a lot of issues and we just reevaluate it later on. And I 100% agree with you. Just focus on big picture things and slowly optimize.
Yeah, I think it's really, really useful advice as well when you're starting out, because I only changed the way I eat in around the last year or so, and it was through talking with Ali. And the best piece of advice I think was just strip it down to eating things that are good for you and stop thinking about the rest. Because when you start reading into it online, especially, there's so much information. There's all the biohacking stuff. There's, questions like you say, oh, should I only eat grass-fed meat, etc. And it can get a bit much and it can overwhelm you. So yeah, I find that extremely useful advice. It's a way into something which can appear quite daunting at the start.
That's a challenge. It's a blessing and a challenge, the online community, because back in the day of Atkins, there was nothing. Nothing, and Atkins was a giant in this New York City area that I'm in, and his absence has left a vacuum, which I hope I can fill to at least a small, tiny part of what he left behind. But I think the big thing is this, that we didn't have keto cookies in the day of Atkins. We didn't have, diet. We may have just had Diet Coke, kind of later on, and all these like sweeteners and baked goods and pizzas. We didn't have these things, and we didn't have the online support and the community that you can get advice from online, and we didn't have all that. So on one hand, it's like an amazing tool, and we take advantage of that tool in our practice. We have like a Facebook group where patients and whoever kind of is part of this community, we kind of curate the message that goes out. We have things like Diet Doctor. We have people like the IDM group, right? We have these online resources that are like curated and we know can help people. But then you have like, I don't know what her name is. It's like Amy, like this keto marketer who like tells people to eat 800 calories of avocado and eggs and that's it. And she sells a whole bunch of supplements, and we have these like, crazy, like, people trying to do protein fasts, and thinking that it's long-term health. Right. So and you have everybody telling you a different thing, more fat, less fat, more protein, less protein, medium carbs, low carbs. So it becomes it becomes tough as a new person to sift through all the stuff.
Mm-hmm. Yeah.
What I could tell people is, I tell all my patients, start with Diet Doctor. Really good. It's not that it's everything, but it's generally curated well produced, and you could start right there. Mm-hmm. And then, follow just smart people on social media and their groups, Jason Fung, myself, Brian Lenskis, listen to the Low Carb MD podcast, and start there. And then, listen to the Diet Doctor podcast with Brett Scher, Ivor Cummings, Christian Assad, all these great people and these great minds. Start with these people, and then, as a base, and then, read about the biohacking and the other stuff. And then when you read about the marketers and the sensationalists, you'll be able to kind of filter out what's real and what's not real. Mm-hmm. But yeah, you're right. It's a big problem. But at the same time, it's a blessing. Look at this. We are connecting here, and many people are going to be listening to you. So on one hand, it's been terrible, all that biohacking stuff you mentioned and like the sensationalism online, but you're going to reach many people, and we're reaching many people at the Low Carb MD podcast. Mm-hmm. And, Diet Doctor is reaching millions. So it's like a blessing and a curse, I guess.
Mm-hmm. Yeah. I
am blabbering on. I'm sorry, guys.
I think mainly blessing as well. I think there's definitely these things to watch out for, but overall, it's such a benefit to have an online community where people can reinforce with each other that it definitely works, and it's not they're not just imagining things. And I think that way it stands far better chance of surviving than Atkins, which did become a fad because partly it got overtaken by food industry
corporate interest. So he died, and then it went into corporate interest mode.
Yeah,
and I think he would be rolling in his grave right now. Mm-hmm. I don't think I think that look, the ADA in 2019 now recommends low carb and ketogenic diets. We're on a new era, paleo and keto are in a new era, and the other thing is this is like, I think the diet wars, look, I think whole food plant-based diet can be better than the standard diet. A lot of people who are keto or paleo or carnivore, they really knock the vegan way. And yeah, vegan with soy burgers and Beyond Meat burgers and Oreos, it's not an ideal, but whole food plant-based diet can be great. I mean, avocados, nuts, artichokes, berries, like you can really get an awesome diet.
A few of the right supplements thrown in.
Yeah. It needs to be more planned. But it could be a big improvement over standard diet. So, I think really, it's funny. I was listening to a plant-based audiobook that many people, I have to expose myself to what's around, so I even read people that I would never agree with who say eggs are diabetes and cancer, and we're protein addicted, society, like Dr. Greger and Dr. Garth Davis. I don't agree with the major part of the message, but, when you listen to them, they're saying the same things we're saying. They're saying, let's get people off medications, medications aren't helping you, fix the diet, fix the lifestyle. So the message is the same. Mm-hmm. If you take out the ideology of meat is bad and meat is going to kill you and save the environment, blah, 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 these things that are like, they've taken to an ideologic level. Okay. If you take that out, the core message is the same. So I try to reach out with, I talk with Garth Davis often, we message and kind of chat with each other about things we see and notice. And I think we got to bridge the gap on lifestyle medicine. Yeah. Because it doesn't help to have, we're trying to do the same thing really. And, yeah. and we like the keto, low carb, and then the whole food plant-based, like we're against the convention. You know, it's just like they're against each other, which I don't think they have to be.
Yeah.
You know? Anyway, that was an aside.
I'm still curious about the food, the Armenian Syrian food.
What's that?
I'm still curious about the Armenian Syrian food that you grew up with.
Oh, yeah.
Did you inherit anything in particular from that, or do you cook that way nowadays?
I basically do the grilling, and my wife does the cooking, I would say. So like she'll make the tabbouleh, she'll make like the mahamara, which is a walnut and red pepper based paste. So you basically take walnut, you blend it, or you chop it up, and then you put some red pepper and you grind it up, or red pepper paste, and you grind it up, and it's awesome. You know, very spicy paste, right? Or if she makes hummus, you know, so she does kind of like the preparing. You know, she'll make the tabbouleh. She'll make some of the stews that we eat, which are like, you know, basically like a broth with like, you know, chunks of meat, spinach, and onion, and you know, and then we top it off with like a garlic yogurt, Greek yogurt sauce. You know, so these are some of the foods that are like traditional foods, and then you have like obviously the lamb. I'll do the lamb and the kebabs and the, you know, all you know, that'll be my role. So that's the kind of food we grew up with. Yeah. But then it was like the sensationalism of the dessert I grew up with, which was like the paklava became like, you know, after every, you know, big party or you know what I mean? It was there, like trays and trays of paklava, you know. So there's the bastardization of that, I guess, to some extent. So that was like the diet I grew up, you know, the ethnic diet I grew up with, and we've taken that. My wife's Armenian, so you know, we've obviously continued some of that for ourselves and our kids. Yeah. Yeah, absolutely. You know, a lot of tasty foods.
So when you're talking to your patients, you know, you've talked about this trajectory away from, you know, processed foods, sugars, all the crap, snacking, uncontrolled hunger, towards, you know, eating less, being more in control of your hunger, eating whole foods, etc. How much emphasis would you say you place on the, you know, the enjoyment of food in that ideal state that you're trying to get them towards? I mean, it sounds as though you enjoy eating and cooking yourself.
Yeah. So actually, I one of my famed statements is, you know, food preference is like largely a relic of like these dietitian moderation message, right? It's not something I really agree with. You know, a lot of people coming to me, they fear fat, they fear beef. You know, they literally are like, I don't want to eat it. It's disgusting, you know, because they've been told for their entire lives, they've had turkey burgers their entire life. Yeah. You know, and so I challenge people to re-examine their food preference. Yeah. And, you know, I tell them basically food preference has no real role in a good, wholesome diet. Like obviously you want to eat foods that you like and enjoy. Mm-hmm. And so I'll work with them to get foods they enjoy. But like, you shouldn't be looking to get like, you know, the ideal would be healthy foods that are super palatable, that fill you up, right? That would be the ideal. But the reality is nature has made it that it's not the case. You know, it's not the case. If you take nuts and you put honey on them, they taste great. You know, they taste great. And you can eat them for a long time. You can eat it for a long time, and you're meant to eat it for a long time, right? You're meant to eat it for a long time. So I try to say, you know, if you need something, we'll get you that something. If you need the cookies, we'll get you those cookies. If you need the pizza, we'll get you the pizza, the low carb pizza, the low carb. But ideally, it's meat, fish, chicken, you know, seafood, eggs, Greek yogurt, as much as you want till you're full. I want food to be nourishment, not really like, something you want to be elated over,
Yeah. Okay. Yeah.
it's not always like, we don't have to make it an experience every time. You know what I mean? It's like it doesn't have to be an Instagram. Sometimes I take pictures of my leftovers and I put them on Instagram because I'll always be grilling and stuff. I'll take pictures of it. It's like, it's not always pretty, it's just food. So I don't want to take the enjoyment away from somebody, because yes, we are people and we want to come together as a family and eat and celebrate and enjoy, and yes, enjoy your food. But there's some element of like having to realize that, like, we don't need to be, every meal doesn't have to be a culinary experience.
Yeah.
It's about nutrition. It's about your health. It's not about, tantalizing the taste buds at every way it can, That's what the food companies do, man. They pulverize the salt in a way that it goes onto your tongue and, lights up every light bulb. They put the right amount of sugar and the right seed oils in it, that make you wanting more. I mean, that's what they do, like, I want the opposite. I want to fill you up, and so in a way that's tasty enough, and that you don't want more. So to some extent, it's like a competing message.
The contemporary culture of glamorizing food and turning it into food porn is almost an obstacle to your message.
It's a minority thing, like, this is like we were talking about the 80-20 percent thing. I don't really focus on it, but if they ask me, I try to challenge them to explore new foods. Make a bone broth, try bone broth, see what it's like. Use it as a stock for a chili. Use it as a stock for soup. Try beef if you haven't tried it. So I try to challenge them to try new things, and I try to also challenge them to go without the things they once craved. Once they're fat adapted and it's easier for them. First, I'll give it to them. I won't, yes, we'll make it happen.
Yeah.
But I don't know. It's no clear cut answer. Sorry to give you a washy answer.
No, it's interesting.
Well, that was such a great chat. We really appreciate you taking the time. I think that's for people probably who already know something about it. It'll have illuminated some things, and I think for the general listener, it'll be fascinating to hear your story as a doctor, going from changing your health personally and actually changing the course of your medical practice around that change, and seeing so many success stories from people. So it's brilliant. And maybe you could tell people where they can find you and more information.
Yeah, sure. My office is just outside of New York City. It's in Tapan, New York. You can reach me at through social media, Dr. Tro, spelled out DOCTORTRO.com. So let's try that one more time. DOCTORTRO is my Twitter handle, and the website is the same, drtro, spelled out.com. Facebook, I'm on Facebook, I'm on Instagram, I'm on Twitter. Call my office if you need a consultation or need help, or you have a family member needing help. You can get it. I'm pretty responsive. My team, if they see questions on social media, they'll forward it to me, as a direct message, or on Facebook, they forward it to me. So just tag me and we'll get in touch with you.
Great. Okay. Thanks.
Oh, and I'll be remiss. Low Carb MD podcast. That's the other one with Jason Fung, myself, Brian Lenskis, who's an amazing doctor doing great things in San Diego. Megan Ramos. We do the Low Carb MD podcast. So that's the lowcarbmd.com.
Fantastic. Okay. Thanks
again. Was that enough of a plug? Was that enough of a plug?
Yeah. Absolutely. Yes. And look forward to getting the podcast out and getting people listening. So hope you have a great day.
Yeah, we're going to get you on. We're going to get both you guys on soon.
Fantastic. All right. Cheers.
Cheers, Joe. Bye.